Wednesday, June 6th. Can we have a roll call, please?
Calling the roll, Ms. Conwell.
Here.
Mr. Hauser. Here. Ms. Baker. Here. Ms. Brown. Ms. Brown is absent at the moment. Mr. Miller. Here. We have a quorum.
All right. Anyone signed in for public comment?
No, no one has signed in.
All right. There's approval of the minutes from the May 23rd. Everyone was here but Nan. So can I have a motion and a second, please?
I so move. Second.
All in favor say aye. Aye. Thank you. Matters referred to the committee, we have none. We do have some legislation that is sitting in the committee that was referred to us. We have not heard it yet. My thought process on that in terms of the ordinance that came from the county executive in terms of the DCF panel is that we should listen to the listening tours and maybe get together and talk about in the different areas what has come out of those listening tours before we actually hear his legislation to see if we need to amend in any way or if it's good as it's presented. Presentation today we have two. Is everybody in attendance for? Okay. I knew I was missing some people. So we will go first with a presentation from First Energy. Mr. Turner will come up and present. And Mr. Turner has some bill payment solutions because many of us across the district the county district have individuals that have issues with paying their utilities. And we know the summer is coming up and many of our seniors need air conditioning. So he is going to bring some solutions to us today for 10 to 15 minute presentation on, because they get those calls as well as we do. So welcome, Mr. Turner.
Before you, I love the printout of our thank you customer assistance programs. And as the chair had indicated in our opening statements, oftentimes we get calls from your constituents, from either city council members or local mayors, and they'll say they'll have an elderly constituent, a customer of ours who is on a disconnect notice or whose electric has been disconnected. And as we do our research on, okay, what assistance is available for that person, we find out, unfortunately, that they could have taken advantage of our programs, but they didn't. And our goal this year, and every year really, is to raise the awareness of these programs. And I won't go through each and every one of these. I'll just hit some high points. The thing that most people are aware of is called PIP, which is Percentage of Income Payment Plan Plus. The way this program works, if an eligible customer has to be at or below 150% of the U.S. federal poverty guidelines, that individual customer will pay either 10% of their gross monthly household income or $10, whichever is more. So if you're thinking about this, if you have folks who are on a fixed income, who may work part-time or something of that nature, and they're at or below the poverty line under these guidelines, it doesn't matter. We don't curtail their usage, but at a minimum they'll pay $10. At the most, it's only 10% of their gross monthly income. That can go a long way when people have to make decisions on how do I buy my groceries, how do I get back and forth to work or school, how do I take care of my dependents, whether they be children or parents. This program is out there for them. Now that summer is on its way. The next program is our HEAP crisis program. If you look at on the right column, this program will officially start July 1st through August 31st. So really it covers, I always say, the dog days of summer, okay? So what this program allows for low-income elderly households and or for Highlands with qualifying medical conditions, once again, must be at or below 175% of the federal poverty guidelines, have at least a member of the household who is at least 60 years old or has an illness that will benefit from assistance. So if you meet the first qualifier, at or be 175% below the federal poverty guidelines, have a qualifying medical condition, or be at least 60 years of age. So once again, this allows for those folks, let's face it, earlier this month or late last month, temperature was in the 90s, it's humid. We had a lot of usage on air conditioning. that's where you start seeing those bills starting to spike. So another program for those folks who qualify. On the second page, our Ohio Energy Conservation Programs. I think these programs are actually fantastic. If nothing more, they help low-income customers become more energy efficient and thereby lowering their overall energy usage. So the Community Connections Program offers electric energy conservation measures and energy education to low-income customers. Those programs provided by First Energy, they're administered by the OPAE, allow for customers to take advantage of energy audits, installation of CFL bulbs, blower door tests, air sealing such as weather stripping, caulking, and foam, and appliance replacement, installation, and measure to help reduce the need for air conditioning. So once again, this great community of ours, there are a lot of older homes. So folks don't always have energy efficient windows or doors, things of this nature, things that really impact your energy usage, either heating during the winter or cooling in the summer. So great program for those who take advantage of it. The next program is our Ohio Home Weatherization Assistance Program. Once again, no cost energy assistance program designed to help increase energy efficiency of homes owned or occupied by income eligible individuals. Participants here, we look at their energy expenditure, improve their health and safety. What we look for here though, they have to be at or below 200% of the federal poverty guidelines. So that's a larger drop than the 150 and 175 on page 1. And finally, the Energy Partnership Plan, the EPP. This is funded solely by First Energy, designed to improve the electric efficiency of our low-income households. Once again, folks who qualify for PIP can also use this program. Home energy audits, installing appropriate energy efficiency measures, consumer education, things of this nature. So our goal in talking to members of council, local mayors, really is to push this information out to your community groups, to other mayors. If there's groups that help the elderly, this is there for them. So I would encourage each and every one of you, if you could, please push this out to your constituent and constituent-related groups. I'll also reach out to you guys and email this so you have it. It makes it easier for distribution. Are there any questions at all?
Oh, yes. Just had a few for myself. In terms of all the different guidelines, they're all set at different rates, one at 150, the highest 200. Is there any way that you could send us a federal guideline breakdown sheet for each of those programs?
So actually, CEOCG has that information, and I believe it's on their website.
Okay.
But if not, if you reach out to their VP of External Affairs, he can definitely make sure that that's available to you. Because that's one of the biggest things, how to know who qualifies. CEOCG is a great partner of ours for that level of programming.
Okay, and then number 2, you talked about, on the second page, you talked about the Community Connections Program.
Mm-hmm.
Is this a free audit?
Yes, if they
It
meet
didn't
income
state in
guidelines.
the thing, okay.
Correct.
And then all these do seem like great programs. I think the top ones I knew about was the summer program and the PIP, but maybe Ohio Weatherization Program, but I didn't know about the other 2 that you have listed here, which is good information for me as well as the Cuyahoga County residents. But I know you said you're trying to really beef up and get this information out. Is there any outreach positions available to discuss these? Does your organization have outreach positions available for people to go out and really talk about these programs?
We don't, honestly, Councilwoman Conwell. I'm the primary point of contact, so part of my job is to go out and meet with, and I've given this presentation to the local municipalities. I gave it to Lakewood, Brooklyn, City of Cleveland Utility Committee. So really, I'm just going community by community, giving the presentation, leaving it electronically. CEOCG also does some of that, but I think it really is up to the constituent or customer to reach out to say, hey, I need assistance. What do I qualify for? So our goal is to be a little bit more proactive by saying, here's this information, make sure people are aware of it.
Are they sending them in the mailers as well when they send out the bill?
We have occasionally, but it's not a regular occurrence that goes on. I can find out to be more specific when that does occur.
I mean, I used to do outreach, so programs, you know, we have a lot of wonderful programs around Cuyahoga County, and we have this same thing. We have a lot of resources that are not tapped into because people don't know about them.
Correct.
So we have to think of ways of how, other than computer, because there's a digital divide, and we have a lot of people that do not have access to the computers, maybe getting the information at the libraries, visiting some churches and ward clubs, just expand, because I know every summer we all hear on the news, we've lost a senior due to heat exhaustion. And they were eligible for these the program. So just some suggestions for me, and I'll open up questions from anyone else. Councilwoman Baker.
Thank you, and I know you mentioned to go to the CEODG for the federal poverty guidelines, but just generally speaking, when we talk to our constituents, 150% of the federal poverty, or 175 or 200, can you just generally say what are those incomes? Can't?
Because it goes based on the household size, so I can't
size.
give you a flat number. Obviously, that would adjust based on household of 3 to 6 to whatever it may be. So I don't have that at my fingertips, unfortunately.
All right, I would just suggest that it may be a good idea to include that in your handout because a lot, like the chairman said, not everyone has the computer or access, and they perhaps get lost at the numbers of percentages and not sure what that means. If you had a chart, and I know I've seen them,
Yes.
of, based on household of 2, household of 5, maybe even some other types of income that don't count. They don't count that income, maybe like Social Security. But if you had perhaps something that included that as a handout to give people at least an idea, I might just qualify, that would be helpful.
Thank you. I'll definitely look at that. And if nothing more, if folks are aware to call,
100%.
right? I mean, I think sometimes people don't call at all to see what they qualify for.
Great, thank you.
And on the second page at the bottom, there's our contact information for the illuminating company, and they can just say, hey, at least call them and see if you qualify for something. But I will work to get that for you as well. Thank you, Councilwoman.
In the senior checkup, the city of Cleveland has a benefits checkup sheet, and I believe the county DSASH department tried to emulate or has something similar. Is this information included in that?
I'm not aware of that. I was just actually talking to somebody.
I
and
think
saying
we
no,
need
so-
to possibly include that.
Okay.
I'll connect you with Marlene. It's been some years since I actually did the benefits checkup with my mom, so it might have been updated, and I just wanted to ask that question.
I appreciate it.
It kind of lets, it's a checkup, state, federal, and locally, let seniors that are eligible know what they're eligible for.
Yes.
So I will definitely connect Marlene with you. Anything further? All right, well, thank you, Mr. Turner. It's good information to know. And now it's documented on live stream, so people can always look at it.
If
Thank
I
you.
may just ask one question, if you don't mind?
Yes, ma'am.
I just happen to think, when you track those that are using this program or any of these programs, do you judge the community that does qualify, knowing your community base? What percentage of people are in fact using these programs? Are you able to know whether or not your message is getting out there? Are 50% of those that qualify using it? 25%, 75%? Is your message getting out there that you see that people are at least accessing some of this?
So through the chair, Councilwoman Baker, what we found last year, as we were doing some outreach on some other issues, we heard a lot from our state legislators saying, hey, I have a lot of elderly, I have a lot of working poor, and they raise these concerns. So we're fortunate enough to say, well, let's look at a specific district, pull those zip codes and see what does this really look like for us. And what our research shows us is that by and large, these programs are underutilized. So hence our shift to say we need to be more proactive. And we already know we get calls, but we get calls from various offices that help us with a particular constituent. And now we're saying, okay, let's do a better job of educating folks so that way they don't get to that point. They don't get to the shut off notice, the disconnect, and they're scrambling. And then they have to make some really hard decisions, or they're going to other agencies for payment assistance. Can I give you specific numbers for your district or in the county? No. But I can tell you by and large, these programs are underutilized.
I'm not surprised by that, and I guess that's what you're trying to do, is get out there and make sure people know what's available. But when we have programs like this and they're underutilized, it just seems that we needs to be analyzed why it is people don't know about it, especially those that qualify, and what we can do to continue that outreach that you're talking about and that you're trying to do to make sure that we get a good response for the efforts that we're putting out there to help them.
Definitely.
And she brought up a good point. So Cleveland Housing Network, I know they offer assistance for utilities, so they're aware of these programs, I'm sure.
Correct. So Cleveland Housing Network, CEOCG, earlier this year, we actually did a program with Senator Sandra Williams, and she had us, along with the other utilities, at the table, and it was a way for customers to come down and get assistance on their energy bills. And they would come and say, hey, what do I qualify under the limited company? And we would direct them, or we would help them right there on the spot. So yes, we do work with those other partners.
Good, and I think CEOGC and CHN, they usually get the customer that, like you said, is in dire need at that point. They're getting ready to get shut off, or many of them are eligible prior to. Okay, so we've got to do a better job of getting that information out.
Great.
Any other questions for Mr. Turner? Thank you for presenting today.
Thank you. Go Indians, go Cavs.
And did you Uber in? Did you get my message to Uber in?
I got your message. I braved the crowd, and yeah, well,
Okay,
I'm contributing to the local economy in the parking lots. Thank you.
okay. All right, is everyone here for the consumer-driven blockchain theory?
Yes, I'm gonna get started without her. I
Okay,
can fill you in here.
all right, do you have a presentation as well?
Yes, it's right. Let's see if we can pull it up.
And we'll take a minute to recognize that Councilwoman Brown is in attendance. You just missed Dave Turner's. All right, and if you can state your name for
Oh.
the record?
I'm Bart Wilson.
Is it Barb?
Bart,
Bart?
like Simpson, kind of. So Danielle is not here right now. The reason is she has a lot of patients that come first. She gives back to the community, and things happen, and emergencies happen, and she had to get going to that. I think she might join us, but I'm not sure.
Okay.
But you can see she has her master's in social work from the University of Southern California. She's kind of the lead where we're at. And 15 years in social work as the first responder, and she moved here to Cleveland, and she's finishing up her PhD right now. Let's see, what happened here? All right. So our journey, she has a practice, the Center for Advanced Mental Health Practice, and that is in South Collinwood. Dealing with people in that neighborhood and all their issues. She started the Camp Foundation, which is, I'm the executive director of the Camp Foundation. And through that, we found that there is just this cycle of poverty going on, where once people lost their driver's license, lost their social security card, they couldn't afford to get it back, and then they can't get benefits, things can't start up again. And it was just, we just keep, at the foundation, we just kept hammering away at this and trying to get people identification. And then we also tried to set people with something called net transportation. And that never really got, or it's called non-emergency transportation, pardon me, but we call it net transportation. And there was just all sorts of paperwork and everything that didn't enable us to get it going properly. So that's where we're coming from, just a sense of frustration. We had 2 organizations and 6 people working on trying to get this non-emergency transportation going, for one person in particular. And I mean, we work with people that have all sorts of issues. And it was hard for the 2 organizations, that person and everyone together. We couldn't get it going. It was crazy. So we found that there's just this huge issue. This is where Danielle will be talking about also, by the way, I apologize. So we decided to start this company, Economic and Applied Psychoanalytic Chain Technologies, to help out, to fix this issue, and help out everybody. So what we came up with is, now we're getting back into my sweet spot. This is where I was going to start talking. So I was, I like to start, no, I won't. Okay, so Ikaipu is a personal profile software that provides a free app and web platform to citizens. Basically, it's a more streamlined and all-encompassing service delivery system that meets the needs of the county's most vulnerable populations. It does this all through consolidating the identity and vital records of each individual in a safe and confidential way, while providing a means for service providers to access that information. I can actually, I have it installed on my phone right here. One second. Show you the, you can pass it around, you can click around on that.
Do you put in your own information?
You just hit OK. It'll just go. I have it set up so you can click in there. So Ikaipu consists of mobile apps for all mobile operating systems in 2 different versions. One for caseworkers and agencies, and one for the citizen. What you have there is the citizen version. These apps all have universal adaptability to government and agency systems that hold user data. Now, we realize that not everybody has access to smartphones, but we do find that libraries are a very big resource for the displaced. That's where the website comes in. And this would enable them to update and check their status without having a connected smartphone. So with blockchain, just to start, blockchain-based distributed storage means data is more secure and reliable than traditional cloud services. It enables a shared ledger with minimal transaction latency that allows agencies to reconcile transactions and budgets faster than before, without having to change their traditional service model. A big issue now is with security. And the core tenet and driving philosophy of this project is that the user controls and owns all the information they put in or otherwise upload. We believe this is the property of the individual, not any company that gathers it. Thank you. So why is it a good idea? it can save and generate money. It's cheaper and more efficient than the current troubled solutions that are enabling some of our most vulnerable ones to slip through the cracks. It does this by featuring better security, speed, and lower operational overhead. It increases customer satisfaction and system reliability and allows the county to save on labor, contracts, and equipment. Let's see. This streamlining allows current cash flow to be more productive by the county keeping a much bigger slice of the pie. So what we were hoping to do today was put on a better presentation, and we wanted to do a pilot program in the county similar to ones in Austin and Michigan. We will be launching one on January 1st, but ours is superior to both Austin's and Michigan's. We've just done more research, and we've tested the idea. They haven't tested it yet. Our real-world experience and work showed us the true concerns and needs, which then allowed us to come up with an informed solution. Theirs is kind of more from a boardroom down. Let's see. So there are lots of advantages of doing a pilot program. Danielle is a minority and a female, of course. So they are very in small numbers in the area. So that's another benefit. So making Ikaipu accessible would be great for the community, and it would help increase the quality of life and the vast opportunities for the citizens and the welfare of the community and the economy. That's all I have for now. I apologize. I'm sorry. We had our stuff more together, and then I kind of got thrown off by Danielle not being here.
Oh, that's okay. I know you guys gave a great presentation when you came to my office and talked about it. So I'm just gonna ask a few questions.
Sure.
We had the law department look over. You left me with a booklet.
Yeah.
So we have 3 questions. I can send you back with them if you can't answer them today.
Yeah.
So you suggest that the blockchain technology is more secure and reliable than traditional cloud services, but as we've seen in recent years, some of the blockchain networks are still vulnerable to attacks. Given this software, will it involve since it involves sensitive records of thousands of people who are particularly vulnerable to identity theft? What assurances can you give us that this information will remain secure?
Well, none of the actual information, personal data would be stored on the blockchain. It would be a system of checks that the information is actually there. So it would be impossible for the information to leak because it's not actually on the blockchain.
Okay. Have you been, many of the areas that you wanted to utilize in the court system, employment and family services, have you been coordinating with the state or federal agencies about integrating your software with state-managed software programs? Because many of our programs we have to utilize our state. We have to go with what they provide us. So have you been coordinating with any of those agencies?
Yes, we've been meeting with, we have a meeting set up with the Social Security locally and I believe Ohio. We have people in New York City also working on more funding, and someone in San Francisco as well.
Okay, so what about the state?
Uh,
Because Social Security is federal, so with the state of Ohio, because our computer systems are connected, our software, we have to utilize most of what the state provides or tells us to.
right, the ODJFS. Yeah. That's the next step. We were hoping to see you guys in here in the home court and then move from there.
Okay. State programs often have stringent privacy requirements. Would this require data be provided from any public case management system, or would all the information be provided by the beneficiary?
The beneficiary, yes.
Okay. Have you explored whether you need to get written consent from the individual recipients or reach some type of data sharing agreement with the county or state if necessary?
That would be something we'd have to explore also.
I'm just taking little notes here.
Sure.
There may be limits to what data the county can share with the express written consent of participants, so I just wanted to let you know that.
Right.
Would people have to have a smartphone or a computer access to give their caseworkers access to these records? Or would there be another way for individuals to grant access to caseworkers, like, for example, PIN or a password?
There would be a caseworker app, so a caseworker could come see the person. And there would also be a website so they could go to the library to do it. I don't know, did I answer your question?
So smartphone, so they definitely need a computer access, the individuals, the recipients.
Yes, yes.
Presumably, access to the application will be password protected. What if someone lost their password? What security features are in place?
Oh, it'd be double factor authentication and as well as biometric.
So what's double factor? Because I'm not techie at all.
So it's you need two ways to authenticate it's you. So it could give you a phone call, send you a text. Sometimes it's an email to authenticate that you're the actual one logging in to reset or redo something.
Kind of like your little app you sent around, we had to set up and create something.
Correct. And in the actual version of that, you would set up the first with your fingerprint or facial recognition, that type of thing.
So, we're talking about, you've mentioned about the populations, some of the populations that are already less equipped to verify their identity and more vulnerable to exploitation by scammers and identity thieves. If a malicious actor got access to their login information, it could be particularly harmful. So what you're leading us to believe is that when the software, it's already created, right?
Yeah.
The software, is that there is no way for anyone to infiltrate these logins.
Correct. Yes. Even twins don't have the same fingerprints.
So I'm not techie at all, so I could go on and on with questions, but if some of the major corporations have been hacked, so to speak, how can we guarantee? Because a lot of this information is really.
Yes. Yeah. It's of the utmost importance, particularly with this population. They're very vulnerable, and it's a big concern because something could happen to them and they wouldn't know. How you doing? And they wouldn't know for a while. But that's one of the key aspects of the blockchain. It's decentralized. I didn't bring my whiteboard, but so there's not one place for it to get hacked from. So if you were to hack even the one place, you would only get part of the information, and that would be worthless anyways, because it's not actually the personal information on the blockchain.
I'm going to open it up to questions to Councilman Miller.
Madam Chair, and you're Danielle, I presume.
I am.
Okay, welcome to the committee.
Thank you.
I gotta confess that that blockchain is one of those things like Bitcoin that are very mysterious to me, and so my questions are gonna be at a very basic level. Can you explain exactly what a blockchain is and how it's different from a cloud system?
It's a type of cloud system, and it's just a ledger where everything is written permanently, everything that happens. And then you build applications and uses off of that.
And
I don't know if it's kind of hard to explain quickly. It's a ledger of permanent record that can't be changed, and it's not stored in one area. It's stored over a bunch of areas.
And how does the blockchain save and generate money?
Can I answer that?
Yeah, sure. Yeah.
So I think the issue of how it saves money or how it generates money depends on how the county wants to look at it, how it wants to create the money flow. So what we are proposing as a possible generation of funding and saving money is that with the consumer, it's consumer driven. So the consumer is allowed to create their portfolio in the blockchain. And so the purpose of it is that they can contain their information rather than having to lose it. So they contain it, and then the county then decides that it's the cost to load it by the county into their blockchain consumer portfolio. That's one charge. The other charge is how often will you ask the consumer to then revalidate or reattest the birth certificate, the social security card, and then the driver's license? Because so the county's already managing the driver's license and the birth certificate. The social security card could be an additional piece where the consumer comes into vital statistics, brings their information, proof that this is their social security, and then the county can load it. Once you've loaded it, it's over with. There's no more need for redundancy on the part of your employees having to do it. So, and the important part of ownership of that loading of the social security card is because social security only allows you so many cards. So then it's up there permanently. It's a full portfolio of each consumer within this county. So then you've loaded it. That's one charge to put it up there and load it.
So would the consumer pay the charge to?
Yes.
Yes.
Yes. And then the second is, so for myself and my licensure, I have to reattest myself on certain sites, for myself every 90 days. I'm not saying you can do it every 90 days, but say you want every 24 months, you want to reattest its validity. So then is that $24 or $25? I mean, that's entirely up to you or whoever. So then every 24 months, for an example, it's reattested. The consumer pays for that reattesting fee. So we've also thought of the idea of authentication code. So you can request from us a code. The code is then put to the documents, which then is kind of like a seal of, we know this is you, we accept this as you, and we accept to use it as your form of validation of who you are as you engage in the county services, food stamps, child support, housing, Medicaid. So if you want to reattest it once and then re-authenticate it with a new barcode number, that indicates to everyone involved, that's a verbal agreement that you are real, we accept it, and you can do business within our county with these documents because we've done this. So
So does this create the capability of the consumer having something that they can use to file multiple applications for various
Yes.
different kind of benefits
That's
instead of
exactly
having
the
to
point.
instead of having to fill out
Right.
reams of paperwork repeatedly?
Right. So, and I'll bring myself into this, and I'm sorry for being late. I am in private practice, so I have people that I'm responsible to be available to. So, in my experience here, so my practice is in South Collinwood. It's a private practice, and my main point of therapy is psychoanalysis. So in that, my patients, the reason that I started the foundation is that the issue of economics is constantly pummeling their capacity to remain mentally stable. When you are struggling with financial issues, the first thing that plummets is your emotional capacity to manage all that's going on. So even if the county is saying, you know, okay, we want to reattest it for the sake of validity, that we are going to charge a certain fee every cycle of whatever you choose to think that that's what's economically beneficial to keep the county operating in a fundamentally healthy way. The people in the community already know that whatever that charge is, it's far less than the continuing of losing, getting, re-getting. I mean, they're constantly having to re-bring these documents. And even if they hold on to them, the travel time between each individual business is extremely expensive, which then, if they don't go, they lose their benefits, and here then they're back at the bottom.
I presume in order for this to work, that multiple businesses and government agencies would have to buy into accepting a particular package of information.
That's exactly why we've come here.
If this one requires A and this one requires B and C and this one requires B, D, and E and this one requires D, E, and F, well, you're not going to get too far. 'Cause somebody has to create a standard that multiple folks buy into. Otherwise, you're not going to get too far. Am I right?
No, I'm going to say you're wrong, if you don't mind. The reason is that there's a standard form everybody wants. The ID, the birth certificate, and the Social Security. That's a standard form everybody's asking for, or a variation of. And a second rate can also be a benefit, is that your insurance. Everybody wants the same thing. They want this packet. Do they want additional things? Absolutely. But within our blockchain, they can load as many documents as they like, and they can live there permanently. The consumer, it's driven so that they can allow the caseworker, whoever they'd like, right, to ask for permission. The consumer decides what each person is able to look at. So it's one site, everything they need, regardless of where they move or homelessness or all those issues, changing school to school, that will be irrelevant. It's all the same documents. They can upload them and keep them there. They never have to worry about it again. And regardless of how many caseworkers they change through, that's irrelevant now. The caseworker can immediately get on board, see the documentation. It's over with. There's no more mailing. There's no more stamps. There's no more, well, you've moved 3 times. Now you're at this shelter and that. It's over with. It doesn't matter. We are going to go to the libraries because that's a main source of place for both food, education, and a place to experience what they need.
I'll say just one more thing and then I'll shut up. Just as an FYI to everybody, that there's 2 or 3 counties in Ohio where the county recorder's offices are scanning and storing ID information for low-income people for free, so that they don't have to pay money for something like this. Just for people to be aware of it.
May I respond to that?
You sure?
Okay, so what we're hoping to do is, we're hoping that our relationship and the county, that together we can demonstrate that no matter where you move within the state of Ohio, it's one fluid action. Many people move from one county to another, and it's like starting all over in a whole new country, even though they're loading them for free here. But what we're also thinking about is the capacity to be employed. There's many times where they change employment. Now they won't have to worry about that. We can hold the I-9 so that an employer can look at it with consumer permission, and they can move to different jobs. They get a better paying job. Say they want to move closer to their family and they found a job there. Well, their information is there. It makes it economically stable, or an improvement towards it. And our theory is that it's relative economic stability. So we're not looking about your source of income. We're looking to provide relative economic stability regardless of your income. And we think that this county can do it with us, and we could be successful at it. And then this would be a demonstration model for the rest of the country who is not doing it.
All right, any other questions? Yes.
Thank you. It's an interesting program. I guess, as noted on page 3, it says some of our counties most vulnerable that slip through the cracks. So we're talking about people that are the most vulnerable, those probably with the lowest income. How do they specifically need a social worker in order for them to engage in this program?
No.
Okay,
No.
one is that they don't probably have a smartphone, but secondly, going to a library, that who is going to assist them in this program if they don't have a social worker that is going to understand what it is they're trying to communicate?
Well, the Obama phone now provides a smartphone. So the days of the flip phone are over for most people, except if you choose it. So the smartphone is available. They get 350 minutes. They are Wi-Fi accessible, so you can go anywhere with this Wi-Fi and open it up to use it. As far as the libraries go, that is the mainstay in this county, from my experience, of where everyone goes which to find information and engage with the community. So our goal is that we are going to seek out funding from VC venture capital. 1, because I'm a woman, and 2, because I'm Mexican. So that gives me that, right? Because there's so few of women like me who are engaging in this system. So our goal is to go out to get funding so that we can engage within the libraries and not rely on external, to burden the counties anymore. And that way we can set up profiles, or we can set up trainings. But the majority of who I experience within my practice, none of my patients are living above poverty. They are extremely poor. And so all of them, every one of them, and I have a huge practice, I have a huge reputation, and meaning that I'm all involved in economics, so that's how they come to me with these ideas of, what can they do to stabilize economically to feel better? So all of them are completely engaging in Facebook, Instagram. That's how they communicate oftentimes when their phone goes out, is through these kind of systems. So I do not think that the idea of blockchain is out of capacity of anybody merely because you're poor or you're wealthy or you're whatever. That's the point of relative economic stability in presenting this, is that we are not gearing it. Do I think it's beneficial to people that I care about? Absolutely. But it is not geared towards an environment that's segregated. We're not looking to help the poor. We're looking to bring the county with us to the idea of creating economic stability for everyone, rich or poor. So if you're poor, it's just as beneficial as if you had money. Paperwork is required by everyone, regardless of your income status.
If I may just follow, so to understand then, those that, and in your own words, those are the most vulnerable that slip through the cracks. Those are the ones that I would think would be the hardest to reach, but the most in need. So given that scenario, and talking about, for the most part, needing a smartphone, and I hear you on the government phone that's available, I would think that that would be a huge component to this. And also, if the library is going to be used, a huge component of training, in addition to the staff that's there that would get training, or are you talking about new personnel that would be there to?
So
I mean,
we're
how-
going-
Yeah, how are you going to address the most vulnerable that perhaps don't have or even know about this, to be able to access the government phones so that they, and then also teach them how to use those phones, because that's something also that could be foreign. And then the training that it takes at the libraries, if that's the direction we're going to go, because it's so universal, to help those that are most in need.
Well, the document loading of any of these forms of documents is just merely taking a picture and it loads. The picture camera within our system is also a blockchain component. So it operates no different than if they were on Facebook. It's no more difficult, it's no more ununderstanding. It's completely simple. You take a picture, it loads, that's it.
Well, those that we're trying to reach, I would think the most vulnerable may not even be on Facebook, would they? If they don't have the capacity of the
I'm gonna
technology?
I'm going to put to an argument that Facebook, among people who are in a lower income, utilize Facebook as just like everybody else does to communicate. So nobody that is within my foundation or within my practice or in South Collinwood that comes to see me, I don't know any of them who are not on Facebook. The only person not on Facebook is me.
And how do they communicate through Facebook? Is it through the government phone?
Yes, yes.
And Wi-Fi, through the library.
Through the library?
Yeah.
Okay.
And we would be hiring people on benefits now that know how to use it. That's a main component, is hiring those people, putting
People to
them to
work.
work to show people that might not be as quick with it, people that already know it.
Right.
So it creates jobs that way as well.
Good. Thank you.
And the issue of case managers and social workers, so social work is a protected word. I am a social worker. So when they have caseworkers, they are not necessarily social workers, right? And so among my experience here, so I'm from LA, so I moved to New York City and then I came here. So from my experience in my practice, every one of my people that I engage with have had, at least in the 4 years I've lived here, at least 10 caseworkers each, right? Our system doesn't have to worry about that anymore. They can have 100 caseworkers. It's irrelevant. My important part in being here to speak with you all is that I want people in my neighborhood to be able to keep on moving every day, no matter who's in charge, their life just keeps moving and becomes stable, regardless of whatever's happening else. They have the freedom then to, maybe I want to move to this county, maybe I want to move to near my cousin, maybe I'd like to help my mother, right, by helping her load her stuff instead of running around and waiting for people to call me back. And there can't be anything worse than waiting for 3 hours for somebody to call you about your food stamps, right? And I'm sorry to get very passionate about it, but I will. If I'm poor yesterday, I can guarantee you I'm going to be poor in 5 more months. Why do they have to be checked in with a phone call every 6 months? When I apply for my student aid for my PhD, right, they ask me one time a year, can we call the IRS and get your documents? By all means. They ask me nothing else. I have enough student debt to wallpaper with, but nobody's they're good with that. Yet my people that I see, they're only getting $14 worth of food stamps, and they gotta be on the phone, they lose their minutes, they only get 350 minutes. They will lose all their minutes just waiting for Cleveland
Ms.
Clinic.
Jonay, we have some other council members
Sorry.
that want to ask questions. Councilwoman Brown?
Thank you, Madam Chair. So I guess the question that I have for you is, you've indicated multiple times that you don't need a social worker for this particular service or app. So what are you looking for? Are you looking for some funding from the county? What are you looking for from us?
So the caseworker is a vital part to keeping
keeping everything going, keeping their benefits going. The difference is they don't have to, the caseworkers can change multiple times. Currently, when a caseworker's changed, they have to get a letter, they have to communicate. There are times when if one caseworker leaves, the paperwork doesn't go in the right direction and they lose their benefits. In this case, the caseworker can see for themselves every time if they change what's happening to the person, and they can just kick right back in and keep the ball rolling, right? So what we're looking for is merely a relationship to create the project and try it out. We're not looking for money. We're looking for the opportunity to try the project and see if it works, communicate with the consumers and ask them, is your life better? Is it better economically? Are you achieving something by this kind of interaction with technology? So it's a relationship between us to run the project.
Councilman Hauser.
So I have a question as well. When you say you're looking, so are you looking for our residents' information to be able to communicate? So the pilot program, you basically want to test out your program or application through county residents to see if it's efficient or not?
So how it'll work is this, is we are looking for the 5 agencies that interact the most: child support, mental health probation, and mental health court, food stamps, Medicaid, and housing. These are the ones that interact the most. We're looking to pilot the project with 5 workers in each department. And then we're asking those workers to, and we'll write a letter together and submit it to 10 consumers, 20 consumers, and we'll send a letter out and say, would you like to join our project? In our project, we're gonna help you load you and your children or your relatives, whoever that you are fundamentally responsible for, and we're gonna help you go into the consumer blockchain and live in this way. And from this, we're going to monitor with a pre and a post test and then a monthly questionnaire. How is it working? Have you saved money? Has your benefits stabilized? Have they been unstabilized? No change. Are you experiencing something that then allows your life, meaning employment, daycare, going to school, are all those things now stabilizing because you're living in this style of experience of blockchain? Have you saved money? Have you not had to spend money on bus? Did you not lose your job because you had to go several times down to a county office to turn your paperwork in? What has happened? That's what we're going to monitor.
So after the pilot program, what would be the next step? Let's say this is a successful program. What ideally do you see? Would you then come and ask for funding, or what's your ultimate goal of this?
Our ultimate goal is that everyone in this state can interact on our blockchain. When they interact, the freedom to come and go as they would like to, because they now have relative economic stability. Maybe they'd like to move to another county because they have a job offer, but they're still living within an economic piece that requires the assistance of the county. That county can just door knock on that consumer, recognize they're moving, everything keeps rolling. The consumer knows that they're now recognized in this other county, and they can freely move to this new job.
Okay.
Job, school.
Okay.
So what we're looking for is to test the pilot, do the research, come up with results, publish the results, and then hopefully consumers in this county will all join it.
And my last question, I see one of the things you have listed for the pilot program advantages is to help fight the opioid crisis through the mobile app. Would we be providing the resources, or what do you have in mind when you put that?
The resources will be us. So when we say that is, the point of the use of technology is it's simple. It doesn't require an army of something. They load it, we train people, they use it, and we see if they benefited. It's an independent act per the consumer. That's the goal, is that they can engage how they would like to in their life independently. They don't need 5 workers to make it move for them. The workers can independently keep their stuff going. While it's a mutual assistance without the weight of papers and phone calls and these kind of things. Doesn't exist anymore.
So also to combat the opioid crisis, it provides a framework to access current programs, as well as a map program that shows like the closest. Then,
Like rehabilitation and treatment.
right, ER.
Facilities.
What's the
Naloxone.
naloxone. So it says, help me now. You click on that, overdose. There's a thing. Where's the nearest naloxone? You get that. So it helps in that way also. So there's a couple other ways it's doing. So it helps. It gets them easily, quickly to current resources, and then there are also resources we're adding as well to it.
I mean, when you're in crisis, the last thing you have is your paperwork. So you don't have to think about that anymore. If you want help or you need help in literally anything, right? It's all available to you now. You just allow that agency access. They can look at it. The point in this relationship is that what we're looking for is the county is going to say, okay, for this pilot project on these 100 people, we are saying, yes, in fact, that is authentic documentation that validates who you are for the 6 months. So we can try to see if it works, which I think it will.
Chair, may I ask a question?
Yes, Councilwoman Baker.
Did I hear that there's a charge to the consumer for this service?
Eventually, after it leaves into a bigger experience, then it will be an upgrade. So the upgrade, in order to fund and keep this entire thing going, because as it grows, we will eventually have to create a customer service 24-hour database capacity for the patient or the consumer to contact us. So, and then we will also have to improve as the data systems change or get better, or we will also have to pay for that. So we will need some form of upgrade within ourselves in order to afford the cost without going to external requests for money. That's the point.
Do you have any idea as to what that charge could be?
It'll be 97 cents
97 cents for a year,
per month.
so $12 a year.
Yes.
I guess my concern there too is as you said, the food stamps were $14. So, someone may weigh the option of, do I get my food stamps for 14 or do I get on somewhat like a membership for access for 12?
Right.
I mean, we're talking about those that are the least in what it is that they have and the opportunities to know about what is going on out there. So
Right, which is why we're going after venture capital, so that we can tap into organizations who are willing to work with us to provide a waiver.
okay. All right, thank you.
All right, any other questions? All right, hearing none, thank you very much, you both, for coming out. As I stated earlier when we met, that I would give you the opportunity to hear, to share what the pilot program is. I've also had some other organizations that you listed as a potential partner in this. Make sure that they were listening so they could give feedback as well. But we do not determine if the county exec will take on programs, but we do have an innovation officer. And so I would like to, that was unable to come down today, but they have the presentation on the website, and I will also share your physical presentation with them. And if they want to move forward with it after we get any if we get any feedback from the other organizations like Office of Homeless Services and Employment and Family Services, I know you wanted to deal with the courts as well. Then we could pass that information on to you. But we don't, we fund things, but we don't determine if countywide, there's going to be a program of this magnitude. And there was some questions that I shared with Bark that you missed earlier in terms of coordinating with the state and federal agencies about integrating your software with our state-managed software programs, because many of those offices, Employment and Family Services especially, we have to go on their statewide systems. So it wouldn't be us individually saying it was okay. There'd have to be some kind of coordination with them downstate first.
Right.
And Bark said that you guys were still exploring that model, that you haven't delved into it and have a definite yet, but just to let you know that that would happen.
We really like you, so we came to you first.
Well, thank you very much, but
Well-
there's some partnerships that have
Right.
to be, or some answers that have to, before we could even consider. But I won't hold you up. Like I said, I will pass this information on to the innovation officer.
Thank you.
Thank you both. Any miscellaneous business from anyone? All right. Anyone else signed for public comment? We have 2 speakers. All right.
Ms. Walker Brown?
Welcome back, Ms. Walker Brown. Good afternoon.
Good afternoon. The last time I was here, you closed the meeting by saying that we needed to reach out to the state. And I always believe that before we go to the state, we need to take care of our own business in the county. And
Are you
since-
talking about the presentation that we just had?
No,
or
not the
your-
presentation. I'm talking about from the last time I was here, not this presentation. DCFS, they had the listening tour, and like I told you at the last time I was here, I told you that it would be better recording here than it would be at a listening tour. The listening tour is pretty much a dog and pony show. People who come to the tour to actually tell their story out in the public, they're not even given, their voice isn't heard. And if DCFS was doing so good, we wouldn't have all these kids being taken away from their families. And as long as people are calling my phone and reaching out to me, I'm gonna come here and talk to you guys. Now, what I need from you, because I'm one of your constituents, I didn't get any type of information coming through the mail about this listening tour. So I had to go to the family and myself to see, did their staff, did they do any type of promoting of the listening tour? I was there early, because that's what we conservatives do. We get there on time and early. I was there early and able to tell who all was coming in the room. Y'all had a picture on the media, had you looking like you had a room full of community people, about 70. Well, when I did the actual count, it was 10 community people that actually came in, and 2 of them was on your payroll. Now that's leading back up to, I need to know, I need you to get back with me as far as a budget for this listening tour, and I need to know if there were any private contracts given out for this listening tour. I also need to know, has this here council decided to, Amon had a recommendation that you was gonna have a community advisory board of 8 to 10 people. I needed to know, have you guys voted on that, or has it came into fruition or not? Because the community, we have about 4 to 5 people we would like to recommend, and they would like to go through the process of being a member on this community advisory board for abuse and neglect. Also, I got a call from Tanya Hagler. Last time I was here, remember when I was on babysitting duty? Okay. Well, I got a call from her, and she told me that the grandmother DCFS, Jane Adden, the caseworker, still pushing for the grandmother to take this baby that she really don't want. They done set up visitations, and you had a 1 hour and a 4 hour, and the grandmother still didn't come. And this caseworker is steady trying to take this baby out of this stable condition with a foster mother who had intent to adopt. And, you know, I'm just making sure that we have it on record. But I do need you to get back with me on the budget, the list of private contracts that came from this here listening tour. And I need you to get back with me about the committee. And also, I want you guys to inquire, all of y'all that's here, I want y'all to inquire whether or not these experts, is it a budget for them or are they volunteering time? Because I know that they done went over a 2-week grace period. So I know at some point.
You're talking about the experts on the panel?
Yes, the experts on the panel that Mr. Bootis put together. I need to know if there's a budget with them. And thank you.
All right, thank you, Ms. Brown.
And I will say this, I did receive something in the mail. I don't know if I'm on a special list or anything, but I think you make a great point as far as promotion. I don't know how we're getting the word out about the listening tour, but I do think if we're not mailing to everybody, then we should look into that. I agree with you on that point. Thank you. Yeah.
And Ms. Brown, you will stay after and I could answer most of your questions? All right, thank you, ma'am. Who is next?
Ms. Hill?
He means business. Hi guys,
Welcome,
how
Ms.
are you
Hill.
today?
Good.
I have a recommendation on that you should be mailing to every family member who's had a case with DCF in the last year. As a general, I mean, why shouldn't they be the first ones being reeled in to tell you about some of the failures? I'm one of those cases. I had a baby on May 2nd, 2017. On July 24th, my middle-class life in Brooklyn, Ohio, turned into a nightmare as I found horrible pornography on my 5-year-old's tablet. Research told me that it was my partner. I gotta go. End of relationship, correct? I'm gonna move out with my 3 children. It exposed and exploited his double life that he was living. I explained to him that I came prepared with 1,000 pages of evidence before I confronted him. And over the next 6 weeks, he put me through a living hell. When I finally went to the police and they went to him, his immediate response was, she has postpartum depression, she's suicidal, she's homicidal. And when I've been done writing the list, it's probably a page long of the things he kind of like flipped from the hip because he was facing some felony charges for, at that point, stalking, domestic violence, and other very heinous, questionable stuff. The investigation to this date has never happened. Number one, I'm asking for the Cuyahoga County Council to use its resources through the State Bureau of Criminal Investigation to investigate evidence that I retain, that the Brooklyn Police Department to this day refuses to investigate. I have, upon multiple times, emailed them. I have had 6 pages of interactive communications with their chief. I asked the detective. I went to the police department multiple times. There's a little bit of protection going on here because of a good old boy system. And I don't think that should be left unrestricted. Because truthfully, the simplicity of the investigation is a simple couple of subpoenas that verifies and validates what I alleged in the beginning. Now, when he intersected a detective and said, she's these things, his obligation under his duty of the police was to do what? Engage mobile crisis and these other places to do an intervention. I understand that now under the, so here I am in the middle of trying to move out and dealing with him. He's been messing with me for like 6 weeks and I was pretty exhausted. They do an intervention. I have the Brooklyn Police, Fire Department, and Mobile Crisis, 6 persons in my kitchen for 2 hours. They all do their assessments. I agree to go to Cleveland Clinic and to be assessed some more by 3 nut doctors. I have all my medical records. They all contradict what he alleged. The next morning I came back to pack up and get out while he was at work. And by 2:33 in the afternoon, him and his associate, I'm not gonna name that name today, threatened me out of my home over the phone in front of witnesses who were there helping me pack. My uncle, my sister-in-law, my brother. They've been intimidated. They came to me and said they cannot testify because of the parties involved in this. So I tell you this because at the end of the day, here comes DCF. They were called in on this from Mobile Crisis. It was the worst investigation ever. By the time they were called in, I was in Indiana running for my life under threats. The 3 police there and a DCF there found his allegations to be unsubstantiated. I made it to Kansas where my aunt lives. Went to stay at a shelter in the middle of all this. Everywhere I went, it was unsubstantiated, his allegations. Cuyahoga County DCFS opened an investigation on September 9th because Mobile Crisis called them. Instead of looking at the records that they had on file, because on August 2016, we did an FBI check to be foster parents, by the way. So they had it in their hands because we had been foster parents. Instead of looking at that file that has 20 years of history, including domestic violence and other stuff, they have everything. They didn't look at it. They listened to his hearsay. They later testified to that. Not 2, not 1 concrete piece of evidence that was about a piece of paper. What the lady said about your records, I just want to tell you about the most tail-chasing event of me going to the Brooklyn Police Department, the Parma Regional Dispatch, you have to go to so many different agencies to retain your own records. They all have to be certified for the courts. There's not even an open case. They didn't have anything to sustain a case. But they testified based on his allegations. Jennifer Fowl, I would like her to be removed from DCF. She's testified 3 times, and on the 3rd time, she finally admitted she had never met me nor talked to me on a telephone. She didn't even bring the records to court. She didn't even get the records from Kansas that were available that I signed releases for. Because I've been pretty transparent. I got nothing to hide. Megan Sunyak, she's a second worker under Supervisor Jennifer Fowl. She called me and talked to me for 5 minutes one time. Then, in violation of the Violence Against Women's Act, she decided to take his allegations that are unsubstantiated by the Cuyahoga County Probate Court, who investigated all of them, and dismissed them and expunged them, and then marked my name as a fraud account. Dismissed, expunged, based on fraudulent filing by him, the allegations that he made to all these places. Instead of your DCF workers going down there and having that one-on-one conversation with a judge or using their discretions with the courts, all that power that they have to get that information, nah, we're on hearsay. The allegation alone, it's like me calling you a rapist or a pedophile or something else. The slanderous allegation alone has destroyed my life. I spent 9 years in special operations with the United States military. I ran for Cuyahoga County Executive for the greater good of all. It is abhorrent, it's disgraceful, and you know what? They got a great union inside of that DCF office. Let me tell you about chasing my tail to file a complaint. Online, they have a email that says, here, email customer relations. So after the first testifying, I emailed a prosecutor, Mr. Beery with CCDCF services. He says, it's not my case. He forwards it to Michelle Myers. She returns my email and says, we had no intentions of filing anything on you. My doctor emails them evidence that says, no, She doesn't have postpartum depression. In November, on the 14th of November, on April 2nd, this lady's still testifying that she never received any evidence. Now, I'm going to say in an adversarial way, this is why families do not want to cooperate with DCF. They can't trust them. What the lady's offering here, that left here, I kind of like. You want a document? I'm going to put it on that screen. I'm going to know what I gave you and know what you got. When I went to DCF on April 3rd to file my second complaint, because the one I filed in November on email has never, ever been found. Nobody knows about it. I have copies of it. I got 2 Foot Lockers in the trunk of my car right now. So I filed the November complaint that never got redressed. Then I finally went back to the DCF building on April 3rd, and I met with Stephen. He's the head of customer relations. Spent an hour with him. He said he was going to send the report up to the supervisor of the supervisor. I didn't hear back from him, so on May 29th, I went to the listening tour, and when I saw him, he said, I sent that to that supervisor of the supervisor. Okay, and then I sat with Tammy, the director of DCF.
Tammy Wagner.
Thank you. Her card's in my purse. And, you know, she's investigating this. By the grace of God, thank you. But I went back to DCF a couple days ago, and I tried meeting with the supervisor of the supervisor, Miss Lynn Fox. That's the name they wrote down for me because I didn't know the name. She is Jennifer Fowles' supervisor. Her number is 216-881-4264. But she didn't have any time. She was hiding in her office. She sent out her secretary, Mr. Whitfield. What's his name? No, I said, sir, I just want a copy of the case disposition because he tells me the case has been closed. Let me explain this to you. They have 30 days to do an investigation. On September 9th, they were called in. It was closed on October 9th approximately. It was reopened because my ex filed a custody case and used them as pawns and subpoenaed them. So under duress of having to testify, they testified on the allegations of the filing, not on an investigation that they completed. So I asked for the case disposition, which I'm authorized to get, correct? He tells me that's protected by the state and that it's at the supervisor's discretion. And then they get to consult with the prosecutor's office before I might get a case disposition. Now let me counter that and tell you, in all my domestic violence counseling, they did multiple mandatory reports to Cuyahoga County DCFS. Report number 1, his 2 sons, while I lived in his home, he assaulted them multiple times. Was it consistent? Was it all the time? No. But on the last week I was there and we were in escalation phase, he knocked the living shit out of his son and bashed him into a wall till he dropped to the floor, gasping for air, 14 years old, hit in the sternum like that. Scared me to death because I had an infant child in my hands and was powerless. And yes, I was terrified to call the police. I just wanted to get out because I felt that he was assaulting us on that moment because he was mad at me. We were in a demise. So that got reported. Guess what? They conducted another ghost investigation. They had my numbers. They never called me. November 1st through November 22nd, that investigation went on. They gave him a case disposition for court.
Ms. Hill, I'm trying to understand. I mean, you gave a couple of suggestions at the beginning of what. Now, I was glad to hear the DCFS. You tied it in with DCFS. So, what exactly can we help you with DCFS? Did they remove your child? I know you had an infant child.
I don't have my kid. It's a private matter, Your Honor, ma'am. It really is. It's somebody that's working and playing, you know, they've got a lot of legal money. They've got a great attorney. And there's no funding, by the way, in the county. I told Armin Budish this, and I'll repeat it to you. I believe you guys should lobby to create, like you have a hotel tax, a law tax. There are so many injustices going on between DCF and Cuyahoga County Juvenile Court that your head would spin. It's a disgrace on this county. Much of it's relevant to the cycle of domestic violence, low-income families like she was discussing, caseworkers, DCF cases involved, and non-involved cases. But legal aid's overwhelmed, the system's overwhelmed, and there's millions of dollars in VAWA funding coming to Cuyahoga County. But when you do the demographics and you cross-reference it, you're sending all the VAWA money over to domestic relations, and it's not protecting families that have to go to juvenile court that were not married. It is if you go through the three-ring circus and chase your tail. There's a lot of inconsistent training on it. No one knows about the rights. And when I tried filing a complaint with the Cuyahoga County Inspector General under, some of these, to bring it to your attention, that was mailed, that 500-600 pages of evidence and research was mailed back to me. I was called and told that Cuyahoga County Council and the Inspector General has no jurisdiction over Cuyahoga County Juvenile Court.
We don't.
And I was told that they don't know who does, Supreme Court. And I'll recommend this too. The meetings that you're having, your number one people that you should have at that meeting are the 8th District Court of Appeals representatives. They're the ones turning over case after case after case of constitutional errors, violations, rights, substantive due process rights, procedural rights. And they're the ones seeing this with the few families who can get to that level to appeal the mistakes, the errors, the DCF violations. They could actually, in summation, bypass so many of the things that us as individuals could bring to you, because they could do it at a legal level, a professional level, and at a magnitude that you guys could actually filter to make extraordinary changes.
So you suggest that the Court of Appeals judges need to attend the listening tours?
I've suggested that, yes, ma'am.
Okay.
And also that this is part of the HHS, correct?
Health and Human Services Committee, yes, here.
Another lane of this whole mess is that, like the discrimination factor, in my case, I've had to learn a great deal about this word, discrimination, and ADA violations. Do you know what 504, the 504 law is? ADA, American with Disabilities Act 504 law? So like the wheelchair ramps outside, the accommodations to disabled people, that's the lane we're in. Everybody with me on that?
Yes.
Okay. So like in the courts and in DCF, the two that work together, they're not trained in ADA accommodations in a way that is, when you're dealing with the demographically disadvantaged of this community, and when you start looking at the statistical correlations of the level and magnitude of cases between parents or children being disabled, these caseworkers need to be trained as part of their policy and procedure on 504 ADA law under the ADA Civil Rights Act. Because if you've got a deaf parent who can't hear you, but then they raise their voice at you and you say, oh, well, they're a bad parent because they're yelling at you. And I've actually been the foster parent of a family who got pissed somebody off in the court system because they spoke too loud or they yelled. And, these are the things that they should be aware of, and it should be part of their mandatory training before they're allowed to work with family members.
Okay,
You
Ms.
can't
Hill,
discriminate under that.
You need to wrap it up. You're way past the 3 minutes, and I would be happy to speak with you after. I need to get to the.
And I appreciate it.
Okay.
The last thing I was just going to say is the National Institute of Health, their studies on domestic violence, intimate partner abuse, and Department of Health stuff. And I recommend that you guys incorporate a lot of that training locally, and you get on one sheet of music with all your cities to a higher standard. You wouldn't let somebody who kicked a dog not go to jail. If my partner came home and hit me, he'd go to jail. But we got kids in this city that have human rights that are not being protected. And those human rights need to be reassessed with this county's level of standards of how they're seeing it and trickle down to those bottom people, whether it's the police, the interventionist, the DCF, and this county needs to expect higher standards from them and their assessments up front, because Too many children are dying. And by the way, my brother was beaten to death when he was 3 years old, my other brother. So I really come from a family where I understand that loss from a partner that my mom was with. And I wish that the community would stop thriving off of the funding that comes in from all the demographically disadvantaged without getting into a preventative mode of education with kids in the schools and the parents, and, you know. No child deserves to be hit. You don't have to, do that for them to be raised. Thank you, guys.
Thank you, Mrs. Hill.
Madam Chair, we have one more speaker signed in. Mr. Charter?
Thank you.
All right,
Good
good
eve-
afternoon,
good
Madam
afternoon.
Chairwoman, members of the committee. I know we've had a longer meeting, and I want to be brief. I wanted to first say hello, Will Tarter with the Center for Community Solutions. I'm here to share with you that we have released a report called By the Numbers 4. And this is a report that's being presented to you in collaboration with the Mental Health Advocacy Coalition that examines the intersection of mental health and the criminal justice system across the state of Ohio. This report is divided into 5 installments. We have released the first 2 installments. The first one is an overview of the behavioral health system in the state of Ohio, how the different behavioral health organizations are funded across the state, and then also historically. And then our second installment, which we just released yesterday, is an overview of the criminal justice system and specifically differences in jails and prisons. The next installment is going to be releasing survey data that we have done where we have surveyed Adams boards and criminal justice systems like jails and prisons across the state to get feedback on how mental health services are delivered inside of the different criminal justice systems across the state. And then we're going to be releasing recommendations over the next few weeks in terms of how to improve those services. So we feel that this information will be very beneficial to the county in terms of the relationship with mental health and the criminal justice system. And it's timely because we have a lot of changes that are being proposed right now on this very issue, and we are very thankful to have had the opportunity to do this research and hopefully complement the work that's being done on the local level. As those installments are released, I'll be back before you and in the public comment period, and then if the chair provides, perhaps we can do a more formal presentation in terms of our findings. So thank you very much, Madam Chairwoman, for the opportunity to share that information with you.
Thank you. So you stated, is it done? The report's done?
We have 5 installments. We have released the first 2 installments.
I think I've seen.
Yeah, there are 16 pages for the first one, and I think 28 pages for the second one. So they're hefty reports, but the data contained therein, we feel, is very important, and we want people to understand not just the what, but the why and the how we arrived at our conclusions and recommendations.
Thank you.
All right, thank you.
No one else is signed in.
This meeting's adjourned.